Hello everyone, Dr. Cox here, and I wanted to talk about the appropriate steps to take if you're interested in eyelid surgery and for a successful outcome. First and foremost, if you're someone who's looking in the mirror and saying, hey, I'm noticing bags, I look tired, I don't look like myself, hooded eyelids, droopy, whatever it may be, you're collectively noticing something's happening here that is connected with you being emotionally kind of bummed by it or bothered, and there's nothing wrong with saying that, then those two you need to be able to articulate. The more you're able to identify something and describe how it affects you, then when you go to the consultation, you will be in a better position to have a true communication and conversation with your provider. Which brings me to the next step. After you decide I want to learn more about this, then you should schedule a consultation. Okay, Googling online and kind of getting a little bit of tidbits of information, and it's okay to begin to get the ball rolling, but you really, if you're truly serious about something, you should get true data from a provider and have an in-person consultation. And if you're able to be descriptive, then you have such a more meaningful experience when you walk out of the consultation. You'll be able to kind of navigate what you want to do, whether that's yes or no to any kind of proposed treatment plans. The other thing, if you get to the point where it's like, hey, this is for me, the eyelid surgery, I'm going to pursue it, it makes sense, I've met a synergistic provider that we get along and it all makes sense, then scheduling. And scheduling is a logistical process. You don't just come in for the consultation, you have the surgery the next day. There's sometimes medical clearance involved. There are things, check boxes that you have to do in order to schedule your surgery. And that can take weeks and sometimes months for some people, depending on when they would like to have surgery. The other thing is to be prepared. You will have to alter your routine for a new routine, calling your healing routine. It is not something that you just lackadaisically go about. You are thoughtful in preparing for your surgery, meaning from taking time off work, from being prepared for your icing, your nutrition, your sleeping, hydration, light physical activity, mental stimulation, listening to albums, reading books, TVs, learning languages, whatever it may be, things to keep you mentally stimulated while you're going through a period of difference from your usual schedule. So that's extremely important. Like anything in life, the more prepared you are, the better outcome that you will have. Lastly, I'll just say being excited, having a positive attitude. If you've gone through all these steps from identifying, hey, this is something I look in the mirror, it's bothersome to me, let me see about it, go to the consultation. I decide I met a provider that everything that we are communicating about, both ways communicating, makes sense, let's schedule the procedure. Yes, you're going to be nervous, but there should be a silver lining of excitement, especially if you found a place that really resonates with you. So those are my tips for kind of how to navigate initially if you're interested in eyelid surgery. So thank you for your time.